Okay, so today we're going to be demonstrating how to draw up and inject insulin. So a couple of things to note. One big one is that we need to be sure we are using the correct syringe for the type of insulin we have. We're going to either have a U40 or U100 syringes that would go with either U40 per mil or U100 per mil insulin. So this one here is a 100 unit insulin syringe, and this one is a U40 insulin syringe. So once you obviously make sure you have the right one, we're going to practice with our insulin. This is just saline for demonstration purposes, but basically we're going to double check our dose. So say we have a 100 unit type of insulin and we want to draw 20 units. So again, these aren't in mil, these are in units. We're gonna make sure we go to that line and then we're gonna break off that bottom. Now, depending on the type of insulin you have, you may need to roll or shake. So make sure you double check those instructions. If you're rolling, you're just gonna kind of gently roll. If you need to shake, you need to actually like vigorously shake it, okay? So I'm gonna take off the cap, tiny needle, turn your bottle upside down, and put that in there, and then draw up the liquid. Sometimes there's gonna be a bit of a air bubble there. That's okay, just kind of let that go in there, push it back up to get rid of the air bubble, and then go up to the line. Again, we're just gonna demonstrate 20 units today, and there's no air bubble in there. I pull that out. And then usually for this, we like to kind of go in between the shoulder blades or this kind of region here where there's a lot of give to the skin. And we're gonna kind of, you know, not try and give it in the exact same place every single time. We're gonna kind of rotate or go in different areas. Some cats or dogs, you can kind of distract them with their food. You know, while they're eating, you can give the injection, which is kind of nice. But you want to make sure they've eaten. And then you go ahead and just kind of, maybe turn the other way. Yeah, just so we can kind of see good here. I'm going to kind of lift up and create this tent right here. There's kind of like this area here that's kind of nice to go in. I'm just going to go straighten that way so you can kind of feel it go in. I'm going to draw back just a little bit, just like that, to make sure I don't get any blood or anything. And then I'm going to go ahead and inject. There we go.
Did it. Good job.
So a cat, 20 units would be a lot. That was just demonstration purposes, but yeah, pretty easy to give, very teeny tiny needle. And the more you get used to it and use treats and things like that for distraction, the easier it gets.